If you're obese, your doctor may advise you to lose weight. But if you need help to lose it, many doctors will just defer you to a nutritionist or a dietitian. And with 1/3 of children and teens either being overweight or obese and 2/3 of adults, obesity is a pretty serious health risk. And doctors are wanting additional training now to help with obesity care. So you've been talking for a long time about how doctors need more than 1 hour of nutrition in medical school.
Well, this shows you the simplistic approach that we're taking in medicine. I mean, it's not just about calories in and calories out. The bottom line, obviously, is that. And what the doctors are doing in this particular article, which is published in the British Medical Journal, is something that's kind of, it's almost shocking, because it isn't just about calories. It's about why people are driven to overeat, or why they have biochemical changes that result in their overeating. And to call on a nutritionist or a dietitian to try and figure those things out is ludicrous, because all they can do is come up with a diet. Well, we know diets don't work.
Well, one of the things that they were suggesting in this article was that doctors should have scales in their office that measure your body mass index.
Yeah, a lot of good that's going to do. You can take a look at somebody and tell if they're overweight. You don't have to have a formula to tell you exactly what their weight is, how much overweight they are, and it becomes a practical thing. So the approach that they're taking really doesn't make a whole lot of sense.
I think we should talk about some of the things that obesity can cause so that people can realize how serious it is.
Well, I mean, there's hypertension and diabetes and problems with heart attacks and strokes. You get more osteoarthritis. It causes lots of changes that are ones that you don't want.
And then again, there are a lot of things besides just eating too much and not exercising enough that can cause obesity. So this is where it's good for the doctors to check those things. What are some of those things?
Sure. So you're looking at things like trying to find the underlying causes. I mean, is somebody not getting enough sleep? Because in that setting, what happens is your body's in an inflamed state. And when your body's inflamed, it causes insulin resistance and leptin resistance, two hormones that will have a lot to do with determining what your appetite is like and when your appetite center will be turned off. Even being exposed to toxins in the environment can cause inflammation that does the same thing.
And things like post-traumatic stress disorder?
Absolutely. I mean, look at all the people with bulimia who are overweight, or people who are just overweight, period. A lot of the time it's related to physical, emotional, and sexual abuse.
And even medications.
Lots of medications that do it that are real problems. Things like the SSRI antidepressants, or some of the antipsychotics that we use so often, or beta blockers. I mean, or anti-seizure medicines. All these things can have a lot to do with it. And so our approach as a physician should be to do this big workup that determines what's going on. Because we can't just say, hey, go on a diet, because that's like, putting your fingers in the dike, hoping that you're going to stop it from breaking.
Well, so many times what happens when you just go on a diet, it's called yo-yo dieting. So you lose it and then you gain it back. And sometimes people gain back more than what they lose.
Yeah, most of the time that's what happens. So what we need to do is take a hard look at what's happening in terms of why people are overweight, and not just send them off to the nutritionist who doesn't have any training for the kinds of things that doctors already are trained to look for but are not applying.
So it's really important to look at this body-mind connection.
Absolutely, because it's inseparable. It's one thing, it's not two things. There are different perspectives of who we are. And of course, you've got to put spirit in that combination as well. So when we're talking about dealing with people who are overweight, we have to start thinking about things like that. And then there's a whole business about how serious is it when you're overweight? Is it all it's cracked up to be? And I think, Vicki, it's probably not, because there's an article that came out that looked at a review of 100 different studies looking at 3 million people. And what they found is that even in the early stages of obesity, that there was about a 5 or 6% decrease in mortality, which is shocking after all the literature that we've seen that suggests that that should be quite the reverse.
Yeah, that it should be better to be thin. But you know, when you think about it, I've had people say things like, if you have a little extra padding and you do get sick,
Well, you've got
that
some
you
reserves.
might have some reserve. I know my mom, she's 96 years old and she just keeps getting thinner and thinner, and she's lost all of her muscle tone. And you know, if she were a little heavier, maybe she would even last longer.
Yeah.
You know.
Well, we still have to keep in mind that people who are quite overweight and deep into obesity, their risk for dying is substantially higher. You're still looking at least about a
Yeah.
20% increase there. So the whole business of being overweight or obese is in an area where there's some difference of opinion about what should be done. But in general, the physician is the right person to do the workup. Yes, it's okay to use a nutritionist or a dietitian to do that work, but only if it's because you don't have enough time to teach it.
But I think this is a wonderful step now that the doctors that are in the medical schools, that the students are interested in learning more about how to care for obese people.
That's true, and it's just one part of the whole spectrum of what we need to do as physicians. It's a big job to take care of people, and it requires looking at every aspect of who they are: body, mind, emotion, and spirit.